Hi, this is Dr. Walter Lemo, a naturopathic physician who has a practice solely focused in cancer care for over 20 years. I want to talk about the role of progesterone in endometrial cancers. So this was sparked by one of our dear patients who, has had an advanced recurrent disease and began also progesterone and for sleep, and which is an effective treatment for sleep, but also could be an effective treatment to help to put the endometrial cancer to sleep as well. And when they also combined it with Lenvima and Keytruda, so these are kind of a standard that's used. Had a dramatic response, and so obviously everyone's high-fiving and happy with the outcomes, but yet this patient's also doing progesterone. And then I have another patient with an advanced endometrial cancer, and similarly was using it for sleep, and the disease appears to be continue to be stable. And I think what's important to highlight is that I find in practice is that the use of progesterone, progestins in advanced endometrial cancers is not really brought up too much. So here in Vancouver, that's what I've noticed in British Columbia. And yet, there is actually a lot of research, showing its value in cases. So there was a really nice review done in 2022 just exploring this and saying, why isn't this being used more often? So most of the research focuses on progestins, so it's called like megestrol or megase and methylhydroxyprogesterone acetate or MPA. And but there's also, which is not reflected in the research, there are more bioidentical progesterone that's called, say, prometrium is a classic one, that it's not reflected in the research, but yet is a progesterone drug. Personally, I feel it's much more gentle, and so we've kind of been just suggesting that for sleep and other things, especially when somebody has endometrial and advanced endometrial cancer, and particularly those I think who have more of the estrogen and progesterone expression on their tumors might do better with it. But anyways, it's something to kind of bring up because it's such a simple modality that it's not complicated, and so while there's the more, I would say, stronger use of the progestins, the bioidentical micronized progesterones that are commonly used for menopausal symptoms and for sleep, hot flashes, could really do potentially wonders in trying to gently calm things down and also improve quality of life with sleep. So something to think about.